My name is Ashley Soppy, and I am the creator and hostess of the Sharpen podcast. I'm sitting in Alaska right now in my sweet little home, and I am super excited to sit here with Kate, my marketer, in the background. She's my rock. She makes everything behind the scenes happen. And then Laura McGladrey, I'm really excited to sit here with Laura McGladrey too. I got to speak with you a couple of years ago. I think it was maybe episode 34 or something like that, called Psychological First Aid. And it was all things psychological first aid and stress injuries. And when you were listing that list off of what it means to have a stress injury, I'm like, okay, this one, this one, this one, this one. And it was really eye opening for me. So a lot of time has gone by since that conversation. So I'm really looking forward to hearing more about injuries, recovery, and what comes after with you. I do want to start off by saying thank you to Rocky Talkies too. They literally have been there for me for the last couple of years, and I would not be able to produce this podcast without their support. I would have tanked a long time ago. And they believe in all the stories that I'm trying to share with you to minimize future outdoor accidents. So thank you to them. Um, and yeah, well, thanks for everybody for being here in the audience that have stuck with us through the kind of the challenges of video production, which I am terrible at. Thanks to my mom for being in the audience. I could see her, and so yeah. Welcome to the show, Kate and Laura. And Laura, do you want to go ahead and introduce yourself to our audience?
Sure. I'm happy to be here and um, proud of you for trying to do a hard thing, even if brave hard things are hard for a reason. I am a family and psychiatric nurse practitioner. That means I'm a clinician, a prescribing clinician at the University of Colorado at the Stress Trauma Adversity Research and Treatment Center. We call it the START Center. And I'm the founder of Responder Alliance, which is a little grassroots army and collection of responder types and outdoor professionals who are working to advance the national conversation on stress injury awareness and also mitigation. And I'm happy to be back to follow up. I loved our conversation last time and heard from lots of folks that it was useful, and hopefully we can take that to the next kind of level today.
Yes, totally. So today we're going to discuss injuries, recovery, and what comes after. And it really means a lot to me personally because I just went through probably the worst year of my life
Mm,
from getting, I got knee surgery, I got a new ACL, a lateral tendon, and meniscus repair all in one go
mm,
last May, May 2022. And I've gotten knee surgery once before in my early 20s, and I don't remember it being that hard to recover. It wasn't that hard physically for me because I was really strong, and it also wasn't that hard mentally for me that I can remember. But this last surgery and recovery was really awful. And
mm,
I've never been so depressed in my life. And I just was in a really dark place. I really lost my identity. And I felt like I had no tools to move through that darkness. I felt really alone, even though I have the best partner in the world. And he was extremely supportive. I still felt so dark. So
mm,
I get a lot of, my podcast is all about accidents, and there's so many physical accidents that happen to us as outdoor athletes, but we don't really talk about what happens when we have a mental injury. For instance, so say there's a climbing team and somebody, you have the climber and you have the belayer, but say the climber falls because of something, maybe the belayer wasn't paying attention, and the climber gets an injury, a physical injury, but nobody actually pays attention to the belayer who potentially made a mistake, or maybe they didn't make a mistake and maybe they just watched their friend fall and injure themselves, and now they have this trauma, or they might not
mm.
ever want to climb again. So how do people move through that? And that's what I'm excited to talk with you about, Laura, is what are some tools to get people to recover from these traumas?
Mm. Yeah, and I think we might think about the our previous episode as maybe a part one or pre-work, because I
Oh
think one of the things we established in that episode was just a new common language around these type of injuries that are now referred to as stress injury in the industry, and we see that across the climbing and guiding and ski patrol and avalanche injury or industry. Thankfully, we're seeing that across the board. And so what might be interesting today, I mean, when we talked about it previously, it was a introduction of the concept that you could have not have a physical injury and still be impacted physically and emotionally by something that you see or you feel responsible for. And we'll call that a stress injury. But today, I think it'd be interesting to take what we've learned from stress injury care, and that's what we work on with Responder Alliance, and apply it to those tools or support of what if you are also physically injured or maybe only physically injured and there's not a psychological component. So it's kind of fun to think about flipping the script.
Hmm.
And I'll tell you just a brief anecdote a few years ago, I was presenting at AMGA and with Jason Simmons Jones, and the name of the workshop, I think, was just stress injuries, how to care for them. And a lot of people came because they thought we were going to talk about repetitive use or climbing injury, your elbow, your wrist, your
Oh,
Achilles,
like a
and
physical stress injury, like a
a
stress fracture
physical stress,
almost.
like a stress fracture.
Oh.
And so we said to them, hey, if you came to this to learn about a repetitive use injury that impacts you physically and your ability to keep doing your work, you're actually in the right place. It's not a bait and switch because stress impact is cumulative, much in the same way. And it's not really a metaphor. It actually works that same way that sometimes it's cumulative day in, day out. The grind meets I've just lost one friend too many, recreationally or professionally, and then it all of a sudden I can't, you name what's after that. So we thought it was kind of funny because people were like, wait, you kind of got us in this workshop because we thought you were going to talk about what were like the helpful hints and best practices for stress injuries. And we're like, we are. What if we thought they were going to be physical injuries? Well, but they are. So anyway, I think it's kind of fun today to get to change the focus on the impact on us as athletes and professionals when we're injured and we can't go on our identity or our work can't go on at least for a short time as usual. What is the mental health or the psychological impact?
Hmm. One. So I have my physical knee injury and the recovery from that, but I also have this other one that you're talking about, right? This cumulative stress injury caused by this podcast.
That's right. Yeah.
So think about that. So I produced 92 episodes, but I've done more interviews. I've probably done 110 interviews, right? And so that's 110 plus stories that I've listened to and edited that have that are trauma related. So I'm just getting hammered with trauma and trauma
Hmm.
and trauma and all these accidents. So now literally have a stress injury from just producing this podcast, and I don't really want to go climb rocks anymore. I mean, there's so many things that I don't want to do anymore because I'm just surrounded by accidents. Isn't that insane?
Well, I'll tell you the thing that's not, and I feel for you because your role is so unique. But one of the things that we've been pushing for over the last few years is just what we would call fair warning, that the human machine is not meant to see and hear and absorb difficult story of someone doing exactly what you do and be untouched by it.
Hmm.
Um, you know, I think, and we talk about this a lot actually in journalism, but also in medicine, but also in guiding. And also, if you're a climbing ranger in the national park, you thought you're going to get technically good at rigging. You did not think, wow, I'm going to get exposed time and again to people doing exactly what I do, getting injured. So to me, it makes perfect sense. And I think that maybe what is cutting edge, if you will, or just a new way to have that conversation, what I think about a lot, because I also get the phone call sometimes 2 or 3 times a week where I'm sitting now. I'm in a, I'm thankfully just a few miles from one of the most rafted stretches in North America. It'll be like a little quiz. People can guess where that is. But we've had multiple fatalities already this summer, and I've gotten many phone calls already. And if it's winter, then they're avalanche fatalities or aviation fatalities. And I have to ask the same question. How many times can the human hear a story or be a witness to a story before it impacts them? And so the newer way to consider that is just that we have to take care of every exposure. And doesn't mean we can't have exposures and we can't do our job, but we have to see it more of I see it more now as a hazmat exposure situation. Like if you have a exposure to a gas, you're gonna spend time getting fresh air and clearing that out before the next one. And if you just have exposure after exposure without a chance to care for it, mitigate it, and if you're not in a good spot when you were exposed, you're somewhat immunocompromised. So now that we know, kind of fair warning that like, hey, Ashley, if you want to keep doing this for 10 years, you totally can, but we're going to have to build in some mechanisms to screen for when it's too much right now and to mitigate it when it is too much. And in any industry, or even if you're a recreational climber, we don't have to be afraid of exposure to images or
Yeah.
traumatic stress. We just have to have our own sense of efficacy that we'll know what to do. And I want to say that that might be the punchline as we talk about physical injuries, because I too have recently had a physical injury and a broken leg. And I was just at a gathering around a fire a few nights ago talking to, and I think it's okay if he's listening to this, that he's an old timer. He was skiing the backside of the pass where I used to work with patrol, and he just got into low snow backcountry skiing, hit that embedded tree root, and had a femur fracture. And he said to me, my femur's healed. It was, it's been 2 years, but I don't think I can ever ski like that again
Hmm.
because I can never go out there, with a sense that nothing could happen or I couldn't have to spend 6 hours in the backcountry waiting to see if someone's going to rescue me. I feel that way even from a mountain biking accident. What I think is powerful about the conversation, though, is if you feel equipped, if you think, if that happens to me again, I'll have what I need. I'll know what to do. It's a very different conversation for your brain, which is at the heart of traumatic stress, to say, this is why we go into traumatic stress injury like PTSD. Your brain goes, I never want this to happen again because I won't know what to do and I don't know if I can recover. But if we can just change that script to say, if I ever get injured again, I know I have the community who will back me. I know I have the skills and the tools to make it out, and whatever comes next, I can handle it.
But that's hard to do because when you're
Mm,
in, yes, changing the script and like I feel like I've got a great head on my shoulders. I am strong, I'm resilient. I worked for Outbound for 9 years and their values, like I live by their values, tenacity and pursuit. I have a strong spirit but I still found that I was so deep in this dark hole and I'm telling myself I could see myself down there
yeah,
could see Ashley's looking down at Ashley, right? And I see,
yeah,
okay, Ashley, put your big girl panties on, like get up, get out of bed. You can do this. You are strong. But there was no talking. No, I couldn't talk myself into it, and nobody could say anything to me that would make me
right,
feel better or stronger or like I had hope that and,
right,
and and these surgeries, like, I mean, I know that you recover from injuries. Okay,
yeah,
this sucks now, but in 6 months, Ashley, you're going to be walking again. You're going to be biking again. But when you're in it, you
yeah,
can't change the script. Like you can't just say, "Okay, Ashley, you're going to be great in 6 months. It sucks now, but you can do it." There's like no telling me that,
right,
and that's where I felt really stuck.
yeah.
So I hear you by changing the script, but like, how do you believe it when you can tell yourself and everybody can talk to you and say all these nice things, but how do you believe it, and how do you build these tools that you're talking about into your life to manage yourself in a healthier way? That's where I'm cruxing out on.
Yeah, I love it. I think what we should do is go backwards and hear the story so that we know how you arrived there. What I will say, I'm curious about in the conversation is, in those very deep places, I mean, we'll touch base again on the stress continuum and where how far into impact you were. But what we know is that there's a predictable place, and maybe it's in the red, and we'll talk about what that means, where all of a sudden there's people around who love you, but they can't get to you. You
Hmm.
feel like your resources are slim. You don't feel like, despite everyone else believing, that you can too. And I think one of the important pieces about this conversation, in climbing and alpinism and guiding and all the professional and recreational roles that we play, um, is to note that we actually have to preload, for events like that when we can, because we don't know when they're coming. And when they come, we end up relying on the people who just sit beside us, who they carry our hope for us and remind us. But there's something, and maybe we'll circle back to this, that really helps our brains to know that you're in a predictable pattern. That
Mhm.
what happened to you isn't out of the blue, because that feeling that you're talking about, where things get very dark and you feel like no one's coming and there's no hope and there's no chance that tomorrow will be any better than today. If you do the work I do clinically, I've watched so many people get to that point and then find the little bright hope light, and then it gets a little brighter and then it gets brighter, that I actually know there's a predictable pattern, like childbirth, right? You're like, it's going to be cool for a while, then it's going to be not funny anymore, and then you're going to be in transition and you're going to say, I can't do this, and then everyone starts cheering because they're like, oh, that means you're just about to have a kid, you're almost done. And you're like, no, you don't understand, I'm dying. And they're like, I know, everyone feels like that in transition. And then here comes this amazing next thing. Well, I get to be a doula, I think, in some ways, to say, I know it feels like there's nothing after this. And I've watched
Yeah.
a lot of people see light coming, and this is actually how it will come on, and this is what it will look like. And so when we talk today about the tools that we've been using, what you'll probably notice is they all talk about the predictable nature of the first days of disorientation after the accident, the next days of feeling like, this is, why did this happen to me? What am I going to do? What about my identity? The next days of it getting really dark, and then the next days. And if your brain knows there's a predictable pattern, it has a way of coding. I can handle this. I just have to hold on to the tree until the floodwaters pass. But if you don't know that that's going to pass,
Mhm.
then, or that if it ever happened again, that you would get through it again, then it really does feel like, I'm not sure there's a reason to keep doing this every day. So
Mhm.
all that to say, we'll circle back to those tools and that structure. But will you just tell us just give us a snapshot of your story so
Of
we can
my
track along with you? Yeah,
my knee
you're,
injury.
yeah,
Well, so yeah, so I severed well, I severed my AC, or tore my ACL when I was 21, I think, or 22, from bouldering. I just barn doored open and then fell on my knee wrong and snap. You heard the
yeah.
pop. I went to shock, the whole thing, and then got surgery and was fine. And then a couple years ago, or maybe a year and a half ago, I severed my ACL in half. So the repair job that I got from the cadaver in my early 20s failed, and it was essentially
Mm,
just disintegrating in my knee. And then one day it just snapped in half. And I kind of cruised around without an ACL for a while. I was like, well, I actually like pretended it. I actually did the full on avoidance. I pretended it didn't exist. I'm like, I'm fine. I can do whatever I normally do without it, because I had this safety job I was doing safety for a TV show, and I didn't want to lose that job, so I just kept on going. And then I got back from a month long scout for this TV show in the backcountry, and I had just overused my knee just enough, I think. And I still was
mhm.
wearing my brace and taking it slow and really paying attention using trekking poles. But I think I just had fatigued my knee enough to where I was in my driveway, and of course, like, you're in the mountains and nothing happens because you're really paying
Right.
attention. But the moment you come home, and I stepped out of my car, I can't remember exactly what happened, but I think grabbed something from the back of my Forerunner, and I turned, and I think that pivoting motion gave me a bucket handle tear in my meniscus that lodged, it flipped upside down and lodged itself in my kneecap joint. So it
Mhm,
locked my knee, and I had to get emergency surgery. It was
mhm,
extremely painful. And then, yeah, I got a lateral tendon, a new ACL, he said it was a really big, juicy one, and
mm,
uh, and then they fixed my meniscus as well, all in one go. And then I recovered here at my house in Anchorage. The rest of the summer, that was in May of last year, and my summer was just leg up. There was some nerve damage. There was a nerve, I think, severed in my knee during the surgery. So from my middle of my kneecap down to my whole leg to the top of my foot was numb to the touch, and also felt like there was ice being poured on me, or sometimes boiling hot water, or sometimes
mm.
stabbing pains or needles, all kinds of phantom feelings. And I couldn't wear pants for probably 3 months after the surgery because even the slightest bit of touch I couldn't handle. So that
Mm,
because of that, I couldn't start PT for much longer down the road because I was in such so much pain. So that just pushed my recovery down the line. And as a mountain woman, like I look in the mirror and I'm like, okay, Ashley, who are
mhm,
you? And I
mhm.
look at the mirror and I say, I am a mountain woman. I am a woman of the mountains. I love the mountains. I'm my best self when I'm in the mountains. And then you take a mountain woman's legs away from her, and then I
Right,
don't even know what I am. And then
right.
from there on, it just got dark.
Mhm,
And
mhm.
then yeah, I mean, it's July of 2023, so my surgery was a year and 2 months ago, and I am, yesterday I did a 34-mile bike ride, so
Mm,
I'm doing a lot better now, but it's taken me a lot to get here. And
yeah.
that's, and my listeners can relate. I get lots of emails like, "Hey Ash, how did you make that work?" And I'm like, "You know what? I didn't.
Mm,
It was
mhm,
brutal." And
mhm,
that's where you
mhm.
come in, Laura.
Well, it strikes me as I'm listening to you that it's often what precipitates people coming to see me. Again, in a clinical standpoint, we're working to change this because you know, say mental health is one of those things I think that nobody wants to be working with unless they have to. And so, and I think that's something we're trying to change, like physical health. But I think the challenge is when people come to see me, it's usually because they have to, right? Because things have fallen apart, or someone's leaving them in a partnership, or they just can't get off the couch, or they're drinking too much, or they just cannot find that little light anymore, or that reason to be alive if they can't do XYZ. And so what's interesting is I think it's something that we don't talk enough about in our community, that
Right.
when you get injured, you get kicked off the team, not because anyone wants to get kicked off the team, but because so much of our community and time together is dependent on activity, right? Like if you're not backcountry skiing together or climbing together, how do you learn to play, whatever? Like you're playing your instruments maybe on the back porch or something, but you've lost the thing that you love, and or
It gives you the
you're out
spark.
of, yeah, or you're on patrol. On my patrol, one of my favorite people, if she gets to listen to this, went through a knee injury this year, and like she's in dispatch the whole year. And as long as people come and see her, she gets to be, but you're not riding the lift anymore. You're not doing bamboo. You're not. And so I think that one of the things we should start to think about changing the conversation, well, again, look at maybe some structural ways to support that you've suffered a loss when you have an injury like this, and you're now in a grief process, and very often you're doing it alone.
Mhm.
I remember actually, we're going to talk about labor apparently a lot here, but like going into like having my first kid, I was like, nobody can do this for me. People can love me. They can cheer me on. They can sit there and throw ice cubes at me, whatever, but I have to
You're
do
the
this.
one
And
that's doing it.
I have to come out the other side on whatever like being a mother is now, and
Mhm.
postpartum, and that whole whatever change, whatever this is going to be. And I was like, I think this is the only time except for dying that I can really feel like I'm going into this journey on my own. And I think when we go through an injury, or for myself, a cancer journey too, like we end up knowing that people love us and they're around us, but it is a solitary journey. So, one of the first ways I think we can change that conversation is to know that high reliability humans, I'm going to put us all as athletes and guides and rescuers and recreationalists who do hard things, we have a very high, as my friend Marcel's calls it, demonstrated ability to suffer. So we're not afraid to be out there overnight, freezing all night, or being in scary places. But we also don't mean to do it. But when someone gets injured, they often get kind of scooted out of the number one resource that would help them heal, which is the lifeline of each other. So maybe
Mhm.
that's one thing that we could start thinking about: the people on your patrol or in your guiding community who've been out with that ACL or that shoulder injury. They're not just physically injured, they have a social injury now, which means that they don't have access to the structure, the dopamine that they used to have, and also to each other, unless we really change how we do things. And I'll say what I love on my patrol, on the last day I was in dispatch, when when Tanya was, and I hope I didn't ask her for permission. I hope it's okay to talk about her, but when she was going for surgery, I went into dispatch and there were balloons everywhere, and there was plan for lasagna in the oven. And we have a resilience team on our patrol that was really leading that charge. And I thought that's how it should always be. You need to go into surgery. But what we'll talk about briefly is this 333 protocol that it shouldn't just be the 3 days after surgery. It should be 3 weeks after your surgery when your leg hurts and you're feeling scared about what if it always feels like this to touch my leg and who am I now? And then at the 3 months, so that's a 333, at the 3 month, still checking in saying, what's it like now? Because by the 3 month, you're experiencing secondary losses, right? The seasons have changed and you're still not out doing
Mm-hmm.
that anymore. And you've lost friends and you've lost your leg is atrophying and but you've really lost your identity that you lived with for so long. So I think
Mm-hmm.
starting to learn how to build that in and what's hardest for us to do is to keep asking for it as
Mm-hmm.
well. Helps to protect us a little bit, from these moments because we all want to just go into our cave and get better and then come out of it and be on your podcast and talk about how inspiring we are. But where the real magic is, or write the book about it or whatever, we want to talk about it when it's over. But the real magic is getting people in the cave with you, saying, it's really dark here right now, and I don't even know what I need. I don't even know where I am anymore. I've lost my bearings.
So you're saying 333 is 3 days, 3 weeks, 3 months, and that is sort of a framework for circling back with yourself and with your friends and with your, you know, with people that you know that might be injured physically or emotionally, circling back with them 3 days later, 3 weeks later, and 3 months later to help support them. Is that what you're saying?
Yeah, maybe I'll dive into that a little bit more. And this is one of those places where we can learn from best practice in psychological injury screening and treatment and apply it now to physical injury. So I don't know if you're able, Kate, to share for those who can see it, or maybe it'll be in the show notes to pull up the 333
Mm,
protocol. But the 333 protocol, I would say first came out of the Tetons when I was working there with some of the teams there. This idea was that in the trauma literature in these last years, what we find is that we have a practice of waiting till something unexpected happens and then trying to pull everyone together and doing maybe a debriefing, which is an excellent idea, but then that's it. We debrief and then we're like, hope everyone's okay. That was really hard. Good luck. But when you follow the injury pattern formation in the literature, what usually happens is, um, in the first week after a major incident, you're so disoriented and there's so much going on that even if you do a debriefing there, your brain can't always take it in. And so
mm,
almost everyone following, and let's put it in the realms of like maybe a client, maybe you're at the crag and then unexpectedly you see a serious injury or fatality. And then, man, you went out to go climbing that day. Your brain did not expect to see that. And so almost everyone, and there should be one more 333. This is about loss. So we'll circle back there in just a minute. Almost everyone in that point should actually expect to feel disorientation. And so in the first week after a major accident or a physical or emotional injury, we're all at a pretty heightened state of physiologic arousal.
oh
And
yeah.
and so, right, so that means is, we do this debriefing and you're all still fired up and I remember getting a call from a climber once who'd seen a fatality in my state and he was like, I'm afraid I have a stress injury because I just saw someone fall and now I can't think about anything else and I'm not sleeping and I'm scared
And
to
they're
do
replaying it
and
probably,
they're
right?
replaying it in their
Yeah.
head. And now, on top of everything else, they're scared that they're always going to be stress injured. Now I got injured by stress, and it's my great pleasure often to say I can't diagnose you with PTSD for one entire month because it is so normal for your brain to try and reorient to that scary thing. You just saw a rock really hurt someone, and you're trying to rock climb. It takes time. And so at that point, we use the 333 protocol to remind people it's normal to not feel great and have things that feel like PTSD. They're going to resolve for most of us. We try and leverage what we would call green choices, but things that communicate to the brain that you survived things that are nourishing, people that are nourishing. This is when we encourage people, like, don't hang out with that unhelpful, but the person that you feel obligated to call and tell all about the accident because they're curious. Like, don't call them back. Go with the people that you love being with. Go sit by the fire. Go be in the hot springs. Communicate to your brain that you made it. Eat the food
Mhm.
that you love. Do the things you love. And then let's reduce stressors as much as we can, because the number one goal in that first week is to keep, the colloquial way I think about it is the survival brain. How do we know when stress turns into traumatic stress? It's it's when your brain says, I can't handle this. So if we can, in that time, even when you're disoriented, keep telling the brain, you have enough people, you have enough food, that did not happen to you. You can survive this. You have what it takes. Sometimes you won't go into injury formation. So at the 3 week mark, that's what we do. We get together and do things that nourish each other. On my patrol, it's like literally a potluck, try and get some laughs in, try and be together, take time off work if you need it. The number one thing that matters to me in that moment, and all the teams I work with, especially after fatality, is that we don't put people back out in an environment. Some people get scared and they go, should I get back on the rock? Because if I don't do it now, I never will. And I'll say, no,
Get back
you're
on the
in that,
horse is what everyone
get
says.
back on the horse, but there's a time and a place. But in that first
Mhm.
period of reorientation, you're, by nature of the reorientation, going to be in a heightened sense of threat perception. So don't go back to the thing that your brain's going, don't do this in that moment, because, and this is what I was talking about, predictability, there will come a time for most of us that it starts to feel good again. And so in that 3 day, that first week, we just try and protect from more injury and reorient. And this is what I want to say about physical injury, that it's disorienting to be getting out of your car thinking you're going to do one thing and all of a sudden you're on a year and a half trajectory. Your brain needs time to adjust to life as it is now. So at the 3 week mark, what we do then is a trauma screening questionnaire, and we revisit and we say, well, how do you feel now? Because what I can predict to most people is how you feel at the 3 day mark is not going to be how you feel at the 3 week mark. Because
Mhm.
for almost all of us, we're going to be in this heightened sense of arousal. And then day in and day out, we're going to reorient to life as it is now. And we're going to start feeling more comfortable. Our sleep gets better, our concentration gets better, our sense of threat perception improves. And if you follow that out to the 3 month mark, it tends to, for almost all of us, to get better and better and better. Now, there are some reasons we won't go into now that your brain might get stuck. That switch might get stuck in the heightened sense of arousal phase. And that's when we're at high risk for stress injury. So at the 3 week mark, we revisit with each other. We go back and say, did you do the green choices? Did you take the time off work, or should we still? Did you get out with your fishing rod, or did you not? Did we still need to do that? And then we'll do a screening that just asks these questions, and these should be in the show notes. It's called the trauma screening questionnaire, and it's meant for the 3 to 4 week mark. If you still have more than 6 indicators, like I can't sleep, I can't stop thinking about it, I um, everything feels dangerous to me still, and I'm on edge, I don't feel like myself, my body feels revved up, or people start talking about that accident, I feel myself getting revved up, then we simply say, hey, the fire isn't going out for you. We need more support now. And we'll do the same thing at the 3 month mark. This represents a total change in rescue culture, right? Because we used to just be like, debrief it, one and done, and then let's wait for 2 years to see if you got injured. And if you did, we'll try and figure it out. Well, we wouldn't do that for a knee injury. Like, we know you hurt it. We're not going to try and examine you again at 3 weeks. We'll just wait. And if you can't walk in 2 years, we should take care of it. Well, we know by then arthritis is set in, there's all sorts of issues. And so that's what I mean about the 3-3 protocol. And many teams that I work with in patrol and in the national parks and in heli skiing and in guiding use that, but I don't think recreational climbers have gotten to see that yet. And I think it's a useful tool from the psychological. But bringing it back into the realms of the physical injury, when I also had an accident recently and
Was this when you
broke
broke
my,
your leg?
yeah, I broke my leg a few months ago.
And what how
And
did you break your leg, if you don't mind me asking?
I don't mind. I had a great ski season, did all sorts of things, and then went to Moab as we all do after ski season, and then just had what I would call maybe a nothing burger crash. I was out riding with my daughter and just had to bail. And much like you, tried to land in a like a position that I have done 100 times, and it just snapped the ACL and then got my distal femur. So I had a fracture and an ACL tear. I know. And almost because I do this work all the time and because I have an amazing team at Responder Alliance and because I'm steeped in this, like almost at the moment that I was falling, I was like, okay, life's going in this. I felt the pop and I was like, life's going in this direction for me.
Mhm.
And my sweet daughter was with me, and she's a little wilderness medicine guru. And so she got help, and we built the splint I built 100 times for everyone else. And we got me out of there. And I kind of knew from the beginning, and this is where I think it's so powerful to know what the landscape is in those first hours and days. I was like, I'm in a disorientation phase. Maybe we call that a state of shock because you're shocked. Like, I thought I was going back out to the campsite. I'm going to the hospital instead. I thought I was going to go keynote here or go do that or go, I'm going here instead. I'm going to be laying in my bed. Like, this is disorienting. But
Mhm.
I knew, and this is why I think the power of knowing, like, I was like, for the first week, it's going to feel like chaos and I'm going to be scared and I'm not going to have my bearings and I'm not going to know what to do. And then I know slowly over time, I will reorient to the life that's been given to me right now, and it will follow a predictable trajectory. And then at some point, whatever happens with the injury, I will be more accustomed to life as it is now.
Mhm.
And having that structure, what our brain does not like from a traumatic stress standpoint is novelty and disorientation. Our brain doesn't like to say, I've never seen this before. And the longer I do this work with people, and I do work with teams who've lost one of their own, and I sit with many people after avalanche and fatality and drownings and that have been primarily disoriented by this loss. And over time, I've learned to say, if we can give you structure, if we can plan the first hours, and I shared a document that we now often will hand out after a fatality or a major near miss that actually says, hey, if in the first hours after this incident, you can employ psychological first aid, you can communicate to your body that you survived and fire off the all clear signal. If you can find the people who actually comfort you, not the ones you're supposed to be with, but the ones who you want to be with, if we can create a plan for the next 72 hours for your brain, including you're going to go to the hospital, we're going to have to ice it, they're going to fly you out, whatever's going to happen is what's going to happen to your kids, whatever. So you can predict something because in that moment, you can't predict anything. That is at the essence of what helps to mitigate traumatic stress because the sooner we fire off that all clear signal, the sooner we give them their own efficacy or a job to get themselves out, the sooner they can reorient, which starts us into acceptance, which then leads us to activation. Because if we spend our time fighting it, then we can't organize around it. We're like, I wish this wasn't happening. Why did this happen? Why didn't I get off my bike? Why didn't I? We can't say this
All
really
the
did
what ifs.
happen. Oh
I
man, I
know,
mean
I
the
feel ya.
the the I wishes and the if
Oh my
onlys
goodness.
are actually at the heart of traumatic stress. They really are. Matter of fact, it's hard to think of people who've ended up in my office from tactical errors or from incidents or accidents that aren't. The if only is what I look for because remember I said there are a few things that help trauma get stuck and then a few weeks later you're still in it. If only is the number one I listen to. Because when we're in if only, we're not in acceptance and we cannot reorganize around what life is like now. And if you can't reorganize, you can't find what we talked about. You have to go study the first episode of the podcast, but we need efficacy to combat helplessness. We need to know that even though we have a broken leg, there's something I can do to help get myself out of the cave. And
Mhm.
structure will give us that, and our community will give us that. But that structure, more and more, I've come to relabel as hope in psychological
Mhm.
first aid. there's a predictable way that life will keep going and I will see the sunshine again.
Hope. It's what we can give
Hope.
ourselves and what we can give our friends and our community. Hope.
Yes, and I think, a few years ago, and I put this in the show notes too, we took the 333 is an operational tool that we use after tactical or operational events as exposure events, right? And we employ them with each other. I'm happy to say the Avalanche Center uses it after avalanche fatalities. We see it in the river, we see it in ski patrol, but it's used operationally. But a few years ago, there was a string of avalanche fatalities in the communities of people that I love, where people were like, what do we do for each other? It was during COVID, and it was like, how this grief is too much. What can we do? And so I remember working on this with Drew Hardesty, and I know there were others as we came together and said, well, what do other cultures do in times of grief, and what are best practices? And so we reconfigured the 333 for the people who love you and who are watching you. And I shared that, like, I think the first one might have been like, be a protector. I have to look at them myself. And the second one, I think, is at the 3 week mark, like, pay attention to what those secondary losses are, because by then they're setting in. How can you be the person who shows up at Ashley's house with her favorite Thai food and a good movie and goes, I don't know, I'm going to just come in the cave with you because I don't know what else
Mhm.
to do. Or
Mhm.
long after people are picking you up and driving you because you can't drive, you're like, I'm still showing up. And then at
Mhm.
the 3 month, be a witness. Like, it's not over for you yet. I
Mhm.
will, and Nick Armitage in at Denny Lake and the Tetons, he said the 333 is really about just putting it on your calendar,
Mhm.
right? Just put it on your calendar to, at the 3 month mark, when your friends have been injured, show up, right? So at
Show
the
up.
3 day mark, right, be a protector, like, get them out of all the questions and all the chaos and all the decisions they have to make, and just take things off their plate. Somebody's got to
Mhm.
pick up the kids. Somebody's going to bring food. Someone's going to bring your ice packs, right?
Well, yeah, and I mean, I have a 98 4Runner, and it's a manual, and
Right.
I got, I mean, what leg did you break? Your left or your right leg?
Oh, my driving leg. Let's
Okay,
just say it that way.
so
Yeah.
mine is too. Mine was my left leg. It was my clutch leg, and
Yeah.
I couldn't even get in my 4Runner because my leg was stuck out with
Right.
my huge brace
Yeah.
on, and I couldn't bear weight by pressing my clutch. So I had someone had to drive me around for
That's
like
right.
5 months, and people don't think about that. Like,
Yes.
oh, Ashley's fine, like she can get groceries, and it's like, no, I couldn't. I couldn't even.
Yeah.
So those little things, like, it's so important just to, okay,
Yeah.
it's 3 weeks. Has Ashley gone to the grocery store? Okay, it's 3 months. Does Ashley have any food in her fridge? Or you, Laura, like, I mean, you
Yeah.
have kids, so
Right.
are your kids checking up on you? And like, you said it's your driving leg, so everybody send Laura some some groceries,
Oh,
her favorite chai tea.
I'm driving again, but you can still send me groceries. Well, and I think we all, especially if you're a mountain badass as you are, like, we all have this little timer for how many times you could ask for help. Like, I know you drove me to an appointment once, but like twice now we're pushing it, and 3 times,
Well,
forget
I
it.
don't even wanna ask for help ever. It was the hardest thing for
Ever.
me to ask for help, but that was one thing I learned through my
Yes.
recovery, was be a gracious acceptor.
Right.
Ashley, you are not like anything special, just say thank you. Just be a gracious acceptor, or when you need groceries, ask somebody to help you, and that was one of the
Mm.
hardest things I learned. And thanks, Kate. Kate just put up on the screen, for everybody
Hmm.
that is on the YouTube channel. You can see Laura's 333, and if you can't see it on the YouTube channel, then we will post it in the show notes. And feel free to send me or Laura an email, and we can send you a copy of it too.
Mm. Yeah, I think what you're getting into, and this is the juicy part, I think, is for those who will be driving like I do, listening to podcasts, the 3 days for community, it's a reminder to be a protector. This is whether you have had someone lose someone they love, or have an injury, or a different kind of loss. Maybe they've moved or lost a job, or something else has happened. At the 3 week mark, to be a resource, right? To keep showing up and be like, how are you eating? Or how are you getting your groceries now? I want to get there and get curious. And then
Hmm.
this is really the magic, that at the 3 month, you would be a witness to them, to just listen and ask, because by then we've reached our cultural deadline to keep talking about it. And now we feel like everyone's like, okay, you moved on, right? I know they've been gone for a month, but like, are you moving on? Or your leg is like, it looks like you're walking again. You're good now, right? And like to be curious, because I think the other big thing of being injured, and again, I've worked with so many people who have lived this internal life of pain because they were physically injured, but then they feel that they have lost their very identity as a guide. I mean, if you're a rescuer, I've been rescuing for a few decades now, and all of a sudden you can't help. It's really the loss of identity that I
Hmm.
think leads us to the dark hole. And I think that this is the crucible, right? Where you are getting reformed and probably will not emerge the same person that you started, even if you're walking and doing just fine. And so again, it comes to that acceptance of the fact that your identity may have been tied up with being a badass for a lot of years, and a lot of us get away with that. Some of us are lucky enough to get away with it forever, but for many of us, whether it's a psychological or a physical injury, um, you have to reckon with being mortal and
Yeah.
and the impermanence that faces us with either a cancer diagnosis or a broken leg or a loss of a partner. We cannot cross the same river twice. And so we cannot go back to a time when we didn't know that in some way we were impermanent, or this moment's fleeting, or that in a split second that you're skiing along next to someone, they could be gone. And there's a recalibration that actually depends on community to find your footing, to become, I think that term we could talk about a little bit more, but to become a survivor of something.
I think what one thing that I was thinking about when you were speaking was what kind of friend do you want to be, you know?
Mm-hmm.
And how do you want to show up for yourselves and how do you want to show up for your friends and your family?
Mm-hmm.
And it is, I mean, yeah, you can call and check on someone, but is that enough? You
Mm.
know, not to make anybody feel guilty if it, or make them overthink if they're giving enough or doing enough, but just it's just a question that we should ask ourselves, because
Mm-hmm.
how do you want to show up for your friends?
Well,
And then
and maybe, oh yeah, go ahead.
one thing too I was thinking about was you kept mentioning green, the color green. And in our last conversation together a couple of years ago on the episode called Psychological First Aid, you mentioned the stress continuum, and we did
Mm-hmm.
talk about it a little bit. But if you wouldn't mind just kind of sharing a little bit about the stress continuum and how that can relate to what we're talking about now.
Yeah, before we do that, let me just maybe share one last thought, because I don't want to leave that conversation without maybe offering the good news when you said about what kind of friend do you want to be. This term about being a survivor, maybe this is where we make our move toward eldership in our communities, has been really fascinating to me over the last few years. And when I went through a cancer journey, I'll call it, you come out the other end of all of those pieces, and if you have done radiation, you ring a bell or whatever you do, and you're done with your treatment. And then they're like, great, get back out there in the world. And you are, of course, completely disoriented,
Right.
and they call you cancer survivor. And I remember having this conversation soon after. Again, funny with Drew Hardesty, we have these great fireside chats often. I was like, I work with a lot of survivors of avalanche and survivors of big events who have lost their people, and they're all of a sudden they're changed, right? Like we were just talking about. And this term survivor is kind of like, it doesn't have the same weight in our communities as like if you're an orphan or a widow or something. I like those terms because they signify that you now have a new identity and role, like something you have overcome something. And we don't really talk about the benefits of that. We talk about being altered and changed, but I think one of the things I wanted to say that's cool about that experience, because we go, is there anything good here?
Hmm.
And I think ultimately, when you look at the stages of grief, and Kubler-Ross, when they went through this, some of us hate him, some of us love him, but we go through them in injury, and we go through them in loss. This acceptance and bargain, or so let's say it's denial, like you said, like this will be fine without any intervention, and maybe then it's
Uh-huh.
bargaining, and then you went through these, it sounds like,
Yeah.
and then you're angry, and then you're depressed, and you're like, this is not going away. This is my new reality. But the thing that is not talked about that I find wonderful is that after Kubler-Ross created those stages of grief, David Kessler came along with, I think, her sibling or her child, and said, hey, there's this other phase that we never talk about. Um, and that should be talked about a lot. Like, what's the sixth stage of grief that some of us get to? And you may know this, but the
I don't.
sixth,
What is it?
yeah,
Yeah.
what do you think it is? You're like, is it transcendence? Like what? The sixth stage of grief is meaning. What did it
Mm.
mean that I went through this? What does it mean that I'm the person I am now? What does this newfound compassion mean? What does this wisdom that came through it mean? What does my life mean now? What does it mean that I lost this person that I love? What does it mean that I had cancer? What does it mean that I got injured?
Mhm.
And the meaning is the gooey center to me, because the meaning is, so for some of us, there is no meaning. It just sucked and let's move on. But for some of us, it's like, wow, all of a sudden, I mean, the people who showed up for me when I broke my leg, who kept showing up, I mean, there were many, and I'm thankful to all of them, but so many of them who kept coming back at the 3 week and the 3 month, not 3 months yet, but they were like, I went through this too, and I know what this darkness feels like, and I'm going to keep showing up for you every day. And I thought, man, you learned to be a different kind of human because you went through that. And I'm in that crucible right now. And the deal is I accept. Yes, I apply to that role because I want to be changed. I want this to change me. I don't want this just to be some freak thing. It was, this pain was meant for me, and I don't want to waste it. I want to be a better friend. And I know I will be forever because of what I've experienced in those dark places. So I wanted to just say that because
Mhm.
I think
Thank
it's
you.
important to say that one of the cool things about, like, don't worry if you didn't bring groceries, you haven't broken your leg yet. You but there's something kind of cool about and you listening to all these stories and me listening to people's grief. It changes me in a way that I
Yeah.
accept. It changes my view of impermanence
Yeah.
in a way that makes life precious. Like, some of this isn't bad, we can accept it. So I, not to go on a rant there, so I'll talk about the stress continuum, but I want to say that is some of what we get in exchange for what we've lost or what is so painful. And it's sustaining, I think, in a way that we don't always expect when we go into the first 3 days, that there'll be something there for us waiting in the darkness too. That's a bit of a treasure. So the stress continuum is it's a tool that we first adapted from the military context and theater. It's really a continuum of awareness, right? That shows us that we're not always just either operationally ready and have capacity for hard things to happen, or we are in the red in my office, in that dark place. There are iterations and even a predictable nature that will often go from being operationally ready to reacting to stress, where we may be short fused, where we may not get our bearings. And then there's another point where we might move to orange, or we're actually injured by stress, where life doesn't feel the same, but we keep going. And another then step to where we feel we're in the darkness. And there's something amazing about saying um, that there's a predictable nature, and most of us will high mark in the red at some point in our lives. But if we didn't know in that dark place that there was actually a pathway back toward green, that there were things that we could do, that reaching out to each other, that finding connection, that our own efficacy could change that, then we would be without a map. So maybe the stress continuum is a little bit of a map. And I want to
Mhm.
ask you, because you were familiar with the stress injury when this happened, and then did you know well, what color, where did you find yourself in that dark place?
Oh, in the red, 100% in the red.
Right.
So just reading it
Okay.
here, yeah, I had trouble sleeping. I lost a lot of relationships, mostly because,
Mhm.
yeah, I mean, I felt left behind. I
Mhm.
physically could not hang with my crew because I couldn't be in the
Mhm.
mountains. I couldn't be active. So I lost a lot of relationships because of that. Um, Intrusive thoughts like, yeah, am I ever going to get over this?
Mm.
Anxiety. Well, yeah, my anxiety over the years has greatly increased.
Mhm.
I've had a couple panic attacks. I got extremely depressed, feeling lost or out of control, definitely feeling lost. I've never had thoughts of suicide. Blame, a lot of blame on myself, and hopelessness. 100%. I felt like mostly because of the nerve damage. I felt like, oh my gosh,
Mm.
and I couldn't start my PT till way later. I'm like, I am never going to
Mm.
be in the green again. I'm going to be stuck in the red, and I'm never going to be as strong as I was, and just, yeah, 100% feeling
Mhm.
hopeless. So I was in the red for a
Mhm.
long time, and then I slowly moved to orange. And I would still say I'm kind of teetering between green and yellow even today after a
Mhm.
year and 2 months later.
Mhm. Well, and I think it's really important to say that the stress continuum is is really it's just a map. Like I don't think anyone lives in green. I think if you often the people I meet who spend the most time there are people with committed practices, commitment to themselves, whether to meditate or to stretch or to do their PT or to exercise or to go out with friends when they don't feel like it, right? There's these commitments, but we all vacillate between. And I
Mhm.
think it's interesting what you said too, that another thing we don't talk about on the stress continuum much is when you are in the red, there's inherently it's almost like you got caught in the dark with someone whispering. Like it's the whirlpool of if onlys,
Oh,
it's
they're
the
the
whirlpool of
worst.
projections. It's like the radio station that you're tuned to um, is playing this kind of hopeless. It's like the lights really start going out. And what I think is hard about the red is that the farther you get into the red, the harder it is to actually believe or access the future and the care and love of the people who are trying to get into that room with you. And it matters to know. I mean, if you're listening to this and you're thinking, that's where I am right now, it's still, it matters that those of us who have been there can say, it feels like you're never going to get out. There is a way out. It's slow. It's the lights turning on very slowly. It happens by making one brave step after another to tell at least one person how much you're suffering and that you think you're in the red. It's this like doing the things you know help you, even though everything in you is screaming, I don't have the energy or the time or it won't matter. And sometimes it's, literally the courage to imagine you out there in the sunshine riding your bike, because it sounds like you did this week, when
Mhm.
everything in you says it's impossible.
Yeah.
So sometimes we need creative partners who can literally get us out in the sunshine or out on the snow, even if it's for 5 minutes, because it does not feel in that room like that is ever going to happen again. And then we
Yeah.
perpetuate, right? Then we've lost that little spark of motivation to keep doing our PT or to keep trying.
Yes. Yes. Well, you hit the nail on the head. I mean, I just didn't think I could really do anything. And my partner, a few months, 5 or 6 months later after the surgery, he's like, "Well, what can you do? What can we do
Hmm.
together to
But
get
wait,
you
I just
out
have
of
to stop you
path?
there because it's so brilliant. That was such a cool move. What can you do? Like,
What
is it
can you do?"
nothing? Are you laying on your back, like staring at something?
Yeah.
Like, what can you
What
do?
can you do? And what can
Yeah,
we do together? You can't, yes, you can't go climb a mountain, Ashley, sure. No, you cannot ride your bike right now, sure. But what
right,
can you do? Well, you can sit down. Girl, you can
right.
sit down, right? I'm like, yeah, I could sit down all day. So what he did was,
Hmm.
okay, well, how about this? How about, you love to travel, you love to see the world. How about we go on a 3-month motorcycle trip through Peru? And I'm like,
Love it.
you crazy. Like, and
Right,
he's like, well, you can sit down, right? I'm like, well, what if I fall down? What if I injure my knee? And
right,
he's like,
right.
I'll get you back up. If you fall
Yeah.
down, I will pick your bike back up. And I'm like, well, I can't hoof my backpack and my luggage in from my bike to the hostel. And he's like,
Mm.
I will do it for you.
Yeah.
He's like, you need to go get some fresh air on your hair,
Mm,
like, see the
mhm.
sights, and we need to
Feel
travel,
like
out of the
you
house.
again. Feel like
Yes, he's,
yourself.
I want you to feel like you again, Ashley, and go explore the world. And he mapped this whole trip out, and
Mm,
we went to Peru, December, January, and or November, December, and January, and we went on a
mm,
3-month motorcycle trip.
mm.
And sure enough, he was right by my side. If ever I fell down, I never hurt my knee. I was wearing my really big brace, and we took it really slow. And that was such an amazing experience because he's like, well, what can you do, Ashley? And let's go do it. What can we do together? Let's go do it. And that's what we did. And it
Mm.
really helped me get out of my very deep depression.
Well, okay, so let me say this again in like really no uncertain, super clinical terms, right? Like all I learned, I needed to know I learned from my motorcycle trip. Like, what can you do? What would make you feel the pleasure of being you?
And reignite it. What's going to
And
reignite you?
reignite you.
Yes.
And I will do it for you, right? This coming
Mhm.
alongside and saying, tell me how far you can go and I will carry you the rest of the way. And maybe this is a show also about being a friend or asking a friend to do this. I mean, some of us are lucky enough to have those people, and some of us have to be brave enough to ask someone, help me find what I can still do.
Yeah.
Because you have a lot of people, I think, who share inspiring stories, and I would love to share the inspiring stories of my friends who do amazing things. I think of Quinn, who I was recently with, Quinn Brett, who like she inspires me most of all because of her honesty that never wavers. She
Mm,
never wavers in her honesty of like, I'm looking for the thing I can do. This thing sucks. This thing is great. And I wouldn't use that word inspiring I'm not saying the problem with this word inspiring is what anyone else did to get through is not you. So what we often say in this work is like precision is love. Like you have to find the you and believe in the you that's coming after. And whether like and accept the fact that it won't be the you that went into this, but
mhm.
the you that comes out has to determine like what still gives me actual pleasure that makes me feel like, oh, I got that moment of like me on a mountain or me in the sunshine. Like, even if it's something really small, like sitting by a fire or something that reminds you that future is
Yeah.
hope. And so, and
Yes.
we talked about that with psychological first aid. I always thought that, the elements of psychological first aid and recovery are reestablishing safety, calm, getting connection, building that efficacy or what I can do, and then hope. And hope always felt so elusive. But hope is actually future. Like, how do I know there's a future for me in this body, in this life, whether it's as a guide or some other future that I can't even imagine yet? But you have to cross over that threshold. And I think, again, if you're listening to this um, podcast because someone sent it to you because you are laying in your bed, you just got injured and you're not leaving on your climbing trip, I mean, I think those first things to hold on to are like give yourself that time to reorient to life as it is now. Find structure that you can believe in every day that makes you feel like you, even if it's just a little bit. I'm applying psychological first aid to your moment, right? Find connection, make a plan for every day, make a visit for every day. Find the connection of the people, not who are curious about your accident, but the ones who are really like, I'll just come sit with you while you cry or scream or
We
just
can just stare at a wall
yell.
together. We don't
Yeah,
have to even
let's,
talk.
yeah, but I'm just going to come be with you.
Mm,
Let those people in. And then that hope piece is like, you don't have to feel, you don't have to speed through this. It takes as long as it takes, but there is a predictable journey through for you. And there is what comes next has the potential to be amazing. And I think not amazing like you were hoping it was going to be amazing, amazing as it just is. But I think that's why storytelling and actually your storytelling is really important because our brain, the reason we love the 333 is at the 3 month mark. Even if I'm working with officers and it's a mass shooting and the first week feels like everyone, like, how will we go on? By the time I go back to the 3 week mark, I can teach them to reflect on the fact that it's not as bad now as it was 3 weeks ago. And when I go back at 3 months, we're like, even if it feels like a betrayal to the person that we've lost to go on, or even if it feels hard to like, it still is not like something's moving. Every single day you're healing, life is moving. And I think that's a really important message if you're just getting into the injury or if you're in the tunnel. Because that feeling in the red in the dark cave, it feels like life has absolutely come to a standstill. Nothing's moving anymore. And we need someone to say, no, there's still, it's imperceptible. And I know it's slow,
Give them hope.
but something's moving. And like, what can you do? I love that. What can you do?
Yeah. Well, thank you so much. And I have a hard time wanting to end it, but I
No, I
think
think others may be ready for us to end
okay.
it.
But I do want to offer a little bit of space here at the end to have anybody call in with any questions and or write in the chat box if they have any questions. And while we're waiting for those to come in, I do have a couple questions that folks had sent me beforehand. And so we'll just go ahead and start with those. So again, if you have questions, you can go ahead and put them in the chat box or you can call in. So this question was emailed to me from a woman named Meg a couple of days ago. Does Laura have any advice for older hikers and skiers after injury dealing with loss of confidence, working on
Mm.
resilience, and adjusting to physical limitations?
Hmm. Wow, Megan, that's a really insightful question, and hopefully we started to answer it. I told you that story in the beginning of the backcountry skier. All of us, whether we are injured or not, and it's interesting, even on that 333 for loss, we put aging and changing. I've been at this, as I said, for decades now, and my climbing partners and friends and partners, people that all the people that are in this with me as we go through life are confronted by the things that we used to be able to do easily that are harder to do now. And there's this kind of slow loss that kind of comes upon us as we realize, like, oh, we can't just tear up that and back and not feel it tomorrow, or my hands don't, whatever that is, there's a natural progression and nobody gets out of this alive. So I think that's important because the injury could kind of tell the story. Like you know, the injury is the thing that is keeping me. But we have to kind of, again, precision is love. We have to kind of keep up with life as it's happening right now to us. And I got to make it a very long time before I've done a lot of things like this that have not broken my leg. I was reflecting
Yeah.
like the times I've pitched off something or bailed or
Oh,
should
yeah.
have broken something. I mean, didn't get my fork all the way into my whole like bike should have come apart on me and didn't, all those
Yeah.
things. So very few of us are going to make it through life without these injuries. And what happens when we get injured is that impermanence draws close and we feel our own fragility. And that is a really hard thing to, that's as difficult as the recover from like our proprioception or the physical injury. And so my number one advice would be to be gentle with that process, to honor if your body says, oh, I feel scared now when I get on a bike, to honor that's because you saw a bike hurt your body, or that's because you saw the rock hurt someone else. Um, I will say this, the more we invest in our own capacity and maybe we use that word resilience too much, but feeling like if something happens, I could handle it. I have the people around me. I have the strength. I think physically strengthening our bodies. This is like maybe a little plug for weight training and being strong. I was training for Nordic racing when I went into this injury. I immediately thought, I'm going to trust my quads on this one because I raced all season and I lifted and I was strengthening. So there's something about, we talked about psychological first aid, and Megan, I think this addresses this. I know that we lose muscle mass as we get older, but to really have that efficacy of like, I'm going to do what can you do? I
Hmm.
can work out in the gym. I can strengthen myself. I can work on my balance. I can do Tai Chi. I can do some things that will give me more confidence that if I do get hurt or as I'm getting hurt, that I can overcome that. And then to respect the fact that your brain, when it sees scary things, its actual job is to prevent you from doing those things so that you don't get hurt doing them again. So I
Mhm.
think there, for some of us, I will never backcountry ski again the way I used to because I respond to a lot of backcountry fatalities. That's a deal I made when I got into this, right? But there's other things that don't scare me at all. And sometimes it's like, hey, how can I adjust or pivot to things that I feel really confident in? But I don't think I unfortunately have the magic wand for like how to make that feel safe again. But what I do clinically is that we start establishing safety again in our bodies. Is my body strong for this age? Is my community strong? Is my spirituality strong so I can hold whatever's coming next?
Well, hopefully that answered your question, Meg. Another question came in from Melissa yesterday. Melissa says, I think the answer is yes, but I'm curious about stress injuries developing from prolonged periods of stress instead of one traumatic incident. Is this something that happens? I'm curious because I had a very stressful year for many reasons,
Mm.
but not from one major event. Now I'm finding lead climbing to be not fun when usually it is one of my favorite things. What I'm curious is I don't have the capacity to expose myself to additional stress while recreating at the moment. I'm wondering if this is also a type of stress injury.
Mm.
I'm also wondering more about recovering from stress injuries. I listened to episode 34 yesterday, which was our episode in
Mm.
psychological first aid, but I want to know more. How do you determine when it is possible to recover on your own versus when you should seek professional help? I'm also wondering about strategies for self healing from stress injuries. It's kind of a lot of questions in one, but.
Oh my goodness. Let's just say, Melissa, follow your instincts. The answer is yes. How about that in a nutshell? I'll just say this. I don't know that I could do that question justice, although we do have an online course called Stress Injury Awareness for the Individual Responder Alliance that talks specifically about the stress continuum, about recovery and green choices, and what we can do to kind of self-deploy in our own injury formation. And one of the things we talk about in that course, I've been doing traumatic stress for some time before I realized um, that what I thought I was going to save the world from traumatic images, and yet many people I worked with, the chief rangers, like the pilots, the recreationalists, like they all tugged on my sleeve and said, it's not really those fatalities necessarily, it's the depletion and exhaustion and task saturation and never getting to a win. And again, remember what I said flips the switch from stress to traumatic stress is the feeling I can't handle this.
Hmm.
So you can get there because you're in an event, you're like, I've never seen a river rescue go this way. Or you can get there because you're like, I can't handle one more thing. My boat is at my water line. And it's what Melissa's brain is telling her is actually intelligent. I can't handle one more thing right now. And so most of us, high relatability humans, like we'll just push right through that because we're like, oh, yes, I can. But it's intelligent to say, climbing may feel like too much right now because my brain isn't in the game the way I need it to be, or because my body isn't physically able, or because I'm so exhausted or depleted. So we absolutely now we know that stress injuries are accumulation of depletion stress, mission stress, never getting to mission satisfaction in our work or climbing or roles, and then traumatic stress. It's not just traumatic stress. And so the short version, because I'll have to short this question for the sake of our time, but follow follow the thread of where the stress came from. If it's from depletion stress, if we are working together, I'd say let's just make an inventory of the things that are currently draining your battery in life and charging your. This is actually in the course as well. Like if you have 47 things on the list that are draining your battery and only two charging your battery, that's economics, man. You're
Hmm.
spending way more than you're making. And so, what are the honest and difficult choices to start removing some of those stressors? Because in a way, that is how you get into the bed, right? More drains than you have charges over a long period of time,
Yeah.
particularly if you come into something that scares your brain or is hard. I think Melissa's in a really intelligent place because something's telling her, hey, it's like almost like you're immunocompromised in that moment. It is a stop and fix moment because if something big does happen, I don't feel like I have the capacity for it. And like, that's intelligent.
Mhm.
Respect it and start moving toward how do we shift the balance, taking some of these stressors off if possible, or maybe taking a little break and not stressing the body more. But the cool thing I can tell you to end that is that you can that economics is fixable, meaning that when people start changing lifestyle to say, I have to take some drains off and add some more passions. Maybe they're in other areas. Maybe it's fly fishing or soaking in hot springs or those are mine maybe, but like maybe they're things it's playing
Mine
with your
too.
dog. It's like, whatever it is that's like,
Yeah.
oh, pleasure is coming back in my life and I'm not feeling so overwhelmed. That pleasure of climbing comes back on again, but we have to get through kind of Maslow's hierarchy first. And it's hard to fall in love, love climbing, come up with new ideas, innovate. I don't know, I could get into some really juicy stuff, but if your brain is flipped into survival mode, it's like, we can't climbing. What are you talking about? I'm trying to survive. I have too many things on my plate. And until we right that ship, we probably won't feel that pleasure. But most people that I see who right the ship on their own start to have the pleasure, the lights come back on and climbing. So that's not will not do justice to all those questions, but that's what comes to mind.
Well, Kate is on, and she just texted me. Kate just read a book on boundaries that relates to the battery drainer charge list
Mm.
that Laura is talking about now. So, folks, we'll also write that book in the show notes. So if you want to check it out, you can check out Kate's suggestion. We also have a comment from Ashley, nice name, Ashley Farrer. Sorry if I butchered your last name. Thank you. I'm 4 weeks post ACL surgery, so thanks
Woo-woo.
for all the relatable information and good luck, Ashley. I know how that feels,
Mm.
and you are not
We should have called this
alone.
the ACL
Yeah,
podcast.
yeah. Any other questions come in, Kate? Cool. Laura, is there anything you want to add last minute before we wrap it up?
I think I think it's always lovely to get to be together and talk about what we can do. And I maybe will refer folks to the Responder Alliance website for there's actually an online training for incident support, and we finally, after the years since we've done the podcast, have a training for psychological first response to just learn those
Wow,
skills so
that's
that we
cool.
can offer it to each other. But there's also a lot of free resources on there and links to other discussions, et cetera, for folks who are compelled to kind of follow those threads, because I know we didn't get as far in today probably as we could have.
And Laura, can you say the website for us?
Yeah, Responder Alliance is at www.responderalliance.com.
Okay. Um, so everyone check that out, and I'll also put that in the show notes. If you like what the Responder Alliance is doing, definitely consider donating to their program and their mission to get this information out there and these resources and education. Laura, thank you so much. Thank you so much for taking the time and being with me on the show. Kate, thank you so much for being in the background and supporting this as we're navigating this new platform. Thanks, Mom. I see you just chatted in. Thank you. Learned so much. Yes, we will post the link for this podcast once it's all downloaded and edited and whatnot. But thank you, everybody, so much.